Welcome, everyone. My name is Autumn Hume. I am the account director with the Healthcare Partnerships team at the Muscular Dystrophy Association. Thank you for joining us today for the MDA Industry Update webinar sponsored by Catalyst Pharmaceuticals, titled Patient and Caregiver Perspectives on a New Treatment Option for Duchenne Muscular Dystrophy. On behalf of MDA, we would also like to thank you for all you do for MDA and the neuromuscular community. MDA's Industry Update webinars are programs which provide an opportunity for the medical community to receive information and updates impacting care and treatment directly from pharmaceutical and biotechnology companies. These webinars are just a part of MDA's medical education resources. We encourage you to visit the medical education pages of mda.org. You will find resources such as considerations for case studies, recorded grand round webinars, research grants, and so much more. Now, I would like to turn it over to Lisa Gluss from Catalyst Pharmaceuticals for today's webinar.
Thank you so much, Autumn. I thought maybe we could just take a moment and introduce our speakers, our guests of honor, so to speak. So I will start by turning it over to Dr. Monduy and just have her introduce herself.
Hi, thank you, Lisa. Thank you for inviting me. My name is Migvis Monduy. I'm a pediatric neurologist and neuromuscular specialist in Miami, Florida at Nicholas Children's Hospital.
Thank you so much for joining us. We're very lucky to have you today. And I'd like to introduce Jay and Franklin, our patient and father today, our real guests of honor here. We're so thrilled to have you. Do you guys want to just introduce yourselves quickly?
Yeah, I'm Jay Griffin. I'm Franklin's father, and say your name.
My name is Franklin Griffin, and
You're living with.
And I have Duchenne.
And you guys thank you for your patience as we get started. And again, we're thrilled to have you today. My name's Lisa Gluss. I will play the role of facilitator or moderator throughout our session today. And I'm the executive director of marketing for Agamree at Catalyst. So to kick things off and really dive into our discussion, I thought probably the best way to do that would really be to get to know the two of you, Jay and Franklin, a little bit better, if that's okay with you. And really talk about sort of the experience from your family's perspective of living with Duchenne muscular dystrophy. And I think, just generally speaking, it sounds like sort of maybe a funny question to start with, but tell me what a typical day is like for you. And that could really be answered by Franklin or by Jay.
A typical day. What's a typical day for us? I'd be remiss to start off with that at our home, my wife and I make our home a place of peace, a place of joy, a place where we can be our authentic selves, that we can recharge and be able to do life together as life presents us different challenges. In the morning time, I help Franklin to get up in the morning at 5 a.m. He's a freshman in high school, so he has to get up really early. So I'll get him up, I'll get him dressed, and my wife would run downstairs and get breakfast together, and then I help him to get downstairs physically. So everything takes a little bit more time, and he gets downstairs and he loves to talk, and I'm a morning person, so there's that dialogue. I don't really want to talk to your mom because she loves to talk. Right. And he goes about his day. He gets on the bus. They come pick him up. He goes to school. Every morning I go at 11 o'clock. I go to school to help him out a little bit, and he comes home and he does his homework. And on the weekends, he rides his scooter through the community just to go outside and play, if you will. But sometimes it'd be tough because the sports and the physical stuff that that you thought about him doing before he got here, he can't do those things. So you spend a lot of time trying to focus on his strengths and trying to engage life based off of what he can do and what he likes to do.
And I heard that Franklin, you are in the band
Mm-hmm.
and you absolutely love music. Tell us a little bit about what, how much you love music and what types of music you enjoy.
Most of the time I'm listening to jazz. I actually like jazz a lot. Um,
What else you like?
I don't know.
I also heard, though, Franklin, that you are a really, really good student, which is very impressive, that you take a lot of tough classes at school.
Yeah.
Yeah. What's your favorite subject?
Probably biology, I'm pretty sure.
Ooh,
I
not
just
an easy one.
Yeah, I just took it like last semester. Yeah.
Do you have some tough math classes this year, too?
Yeah, I was in Math 2 honors, I'm pretty sure. It was pretty tough.
So you're pretty advanced academically. That's incredible. Must make your dad and mom proud.
Yeah.
It does.
Well, do you have ideas of maybe where going to college and where you would want to go and what you might want to study
Definitely.
since you're such a
Um,
good student?
Yeah, I'm going to UNC Charlotte and I plan on going there for engineering.
Wow.
Yeah.
Very impressive. This is probably a little bit more of a question for Jay, but how would you say Duchenne has impacted sort of, your family as a whole?
How Duchenne impacted my overall family? Well, that's a lot. It's really, to be quite honest, it's turned our family upside down. If I could be honest with you,
Yeah.
as I mentioned before, you paint this picture of what life is going to be like when you have kids, and you may not know, but we've been trying to have Franklin for over 10 years. So, my wife had miscarriages, we thought we was pregnant, we wasn't pregnant, so a whole 10 years of emotions, ups and
Sorry.
downs, and have kids. And finally you get this blessing comes, and 6 years after having them, you're beginning to play out that picture of what family would be like until the day you find out that he has Duchenne. And that was the day that everything changed. Right there in the parking lot, it changed. So changing that my wife and I had to personally deal with our emotions, how we felt about his diagnosis, what it looked like, how it's going to affect him, what do we need to do to help him. So that's that whole inner emotional, psychological thing that we individually had to deal with. Then we also had to deal with him and trying to safeguard him from what we found out to see about how to help him, to cure him, right? To only feel like, there's nothing that we can physically do in our own strength to do. As a father, for me, it was excruciatingly difficult because my responsibility as a husband, as a father, is to protect and to provide. So if there's a problem, I fix it. You know what I mean? If I had a lung that he needed, I can give it, but I can't give the dystrophin out of my body and give it to him. If I could, I would have already.
Could you would, yeah.
Right. So I
Right.
felt like it's almost like I felt like a lion ready to defend my pride, my cub, but only to find myself to be a lion with a straitjacket on in a room of four walls, not able to protect my kid, only hurting myself mentally and physically because I can't do what I need to do for him.
When did you actually get a referral over to the pediatric neurologist? What age was Franklin at that time? Did you say he was 3?
No,
Much later.
much later. He was about
5?
5.
Okay.
Franklin, okay, so Fraser's they're 2 years apart. Yeah, so it was about 5. When he was about 5, that's when we went to and said, hey, we need to do something different. Then we went to the CK test and we did the genetic test, and then we got plugged into Duke. It took about 6 months, 5 or 6 months. But then there was like a period where February, he mentioned Vermorelone, but we was waiting for the site to be open. So I
Okay.
think somewhere about February, March, I don't know the exact date, but during that time we had to wait decide whether we was going to do vamorolone. But it wasn't until July 1st where the site was open and he actually got his first shot.
Was that a tough decision? How did you go about making that? That's a big decision, to go into a clinical trial. How was that guided in terms of from the HCP, from your healthcare provider?
The decision to go into vamorolone was very tough. It was like taking 4 bad options and deciding on which one you're going to do. Well, we already threw do nothing out the window because we knew that doing nothing was just going to mean that his progression was just going to go like a rocket.
Right.
But then there was 2 other options that we had to consider that we knew what the facts were about those 2 options.
Sure.
And we had to decide would we be okay with those side effects with the other options.
How often, to ask Dr. Monduy a question, sort of, how often do you sort of hear similar conversations amongst families as you're weighing in and you're asking about sort of or encouraging to start a corticosteroid? Does this sound like a very similar journey that other families have taken that you meet with?
Yeah, absolutely. I think it's different for every family, right? Everybody's gonna, process it a little bit different. It depends at what stage of the progression they're in too. But overall, it's a very difficult decision for families to take because, we know that it works. We know corticosteroids help slow down that progression, but they come with a lot of baggage and a lot of side effects and potential for side effects. So people become concerned about that, and the fact that you have to monitor for all those side effects is a big burden too, because you have to do all these other testing and blood work and bone density scans and see an eye doctor and all these other things that we have to watch out for. So it's a constant conversation we're having with families about, if they bring it up or we bring it up, either way. A lot of times, if there's behavioral side effects, families will be quick to bring those up.
Okay.
But other things, it might not come up until we bring it up.
And how often, Dr. Monduy, do you interact with families that are maybe resistant to starting the anti-inflammatory or, the corticosteroid? Do you see a lot of resistance from your families that you treat?
I still do. I think it's gotten better as there's more educational efforts in the community as a whole, but there's still a lot of people that don't want to start, and their child has had Duchenne for many years, and they still feel a lot of resistance. And I still bring it up every visit. I still talk about the side effects and kind of have that conversation about the benefit and the risk and weighing it in a balance, right?
Right.
And trying to get to really that bottom line, what's it really? Because every family is gonna feel different about the side effects. There's some families that are more concerned about fractures.
Mhm.
Some families are more concerned about behavioral issues, especially if the child already has behavioral issues or autism or ADHD. Other families might be more concerned about weight gain, perhaps because there's a family history of obesity. So everyone's gonna have their own particular fears that we have to, get in depth and try to get to the bottom of it. What is it for this one family that they're really worried about? Um, but yeah, I mean, it comes up often, but I still encourage because we do know that it helps, and as long as we're monitoring effectively for those side effects. But it's a conversation I think at every visit. Obviously, Jay is very open about, these things in his family. Not everybody's as open and is willing to share those. So sometimes it takes a little bit of probing, to
Probing.
get to the bottom of that. And it might not be in one visit, right? It takes sometimes time to build that relationship. Like he said, he had a good relationship with Dr. Smith and his team. That was what enabled him to be part of this clinical trial. And that might not be one visit, right? And it's just so much information to take at once when you first get diagnosed and you're learning about all these things. And it takes time to find that team that you could trust and feel like you're part of the family and that they have their best intentions in mind for you. So it's different for everybody.
Is there something specific, or is it what would prompt you, Dr. Monduy, to think about recommending a specific treatment approach or a change? So you have somebody maybe who's been on a treatment for many years, whether it be prednisone or deflazacort. What types of things are going to prompt you to recommend a potential change in their foundational therapy for Duchenne?
Yeah, I mean, it's good that we have different options now. We'll get to talk a little bit more about that, but really it's gonna come down to either efficacy or side effects, right? So are we trying to look for something that's perhaps a little bit more efficacious, more effective in slowing down that disease progression? Something that you might be able to tolerate at a higher dose that's gonna work better, as opposed to having side effects and then having to decrease the dose so that you could tolerate it better, but then we're also losing some efficacy there. So I think it's either like we're seeing that progression, we're seeing perhaps a faster progression that we would expect for that particular mutation, or we're seeing side effects, and then we want to try to find something that's an alternative that might have less of those side effects.
Absolutely. That makes sense. Well, speaking of different treatment options, I think it's a good time to transition into the overview of AGAMREE. And Dr. Monduy, I know you have just a few slides to take us through, so I'll turn it
Sure.
over to you for that.
Okay, thank you.
Yeah, thank you.
All right. So Agamree is one of these new treatment options that we're talking about today. Vamorolone, Agamree is a brand name, and it was FDA approved recently for the treatment of DMD in patients that are 2 years and older. Some important safety information, some words of, some precautions and warnings for corticosteroids in general. So obviously, as a drug class, they could alter endocrine function and cause things like high blood sugar, adrenal insufficiency if you have abrupt withdrawal. There's an increased risk of infection and immunosuppression on corticosteroids. So again, it's similar, has the same warning. And then there's alterations in cardiovascular and renal function. So you have to monitor for elevated blood pressure. In patients that have a Agamree, monitor electrolytes as well. Like other corticosteroids, there are concerns for GI side effects like gastrointestinal perforation or ulcers, changes in behavior and mood, effects on bones in the long term with corticosteroids like osteoporosis and fractures, ophthalmic effects like cataracts and glaucoma, effects on growth and development. So all these are kind of general to corticosteroids, and then thromboembolic events as well, and increased risk. So if you want to see the full prescribing information, you can scan that QR code and it'll give you the whole package insert with all that information there. But the exciting thing about Agamree is really the mechanism of action. This is what makes it a little bit different from the other corticosteroids. It was really designed to still retain that potent anti-inflammatory effect, which is what we need to slow down the progression in Duchenne. But there's a molecular structure difference here, and you can see in the circle in green on the top that there's a double bond, and then on the bottom for prednisolone and deflazacort, there's a hydroxyl group in that same position. So with this, you have in vitro data showing that there's reduced GR-dependent activation of gene expression and an antagonistic effect instead of an agonistic effect like the other glucocorticosteroids on mineralocorticoid receptors in the kidney. So with that in mind, that comes the decreased adverse events that we're seeing. So we're seeing that uncoupling from the potent anti-inflammatory effect that we want to see, but less of the side effects as compared to other glucocorticoids. In terms of efficacy, we only have the short-term data at this point from the clinical study. So this is a study that Franklin participated in. It was a randomized, double-blind, placebo and active control trial. And the data so far has been published up to the first half of the study, the first 24 weeks. So the patients, the four options that Jay was talking about was that you will get randomized in this clinical trial to four different groups. So you either got placebo, they got the standard of care of prednisone of 0.75 milligrams per kilogram of body weight per day, or you got low dose of Agamree or high dose of Agamree. So the low dose was 2 milligrams per kilogram of body weight per day, or a 6 milligram per kilogram per day. And then for 24 weeks, patients were in that dose. Go back to the slide, I'm sorry. And then there were transition. The patients that were already in AGAMREE continue to be in AGAMREE, and then the patients that were in prednisone or placebo then got randomized to either be on low dose AGAMREE or high dose AGAMREE. And obviously, everyone was blinded throughout this period. The primary endpoint for the study was met, and that was comparing AGAMREE at the high dose of 6 milligrams per kilo per day compared to placebo. And in particular, they were looking at time to stand velocity. So you can see the graph here. In black, you have the placebo group, has declining at 24 weeks. And then you have the low dose and the high dose groups, how they're improving in their time to stand velocity. And these were clinically meaningful improvements, with obviously the higher dose group, the 6 milligrams per kilo group, having more of an improvement than the 2 per kilo. Other secondary endpoints were other functional tests that we measured during the clinical trial, including the 6-minute walk test and then the time to run walk 10 meters. And in those, again, you see improvement compared to placebo in both groups, the low dose and the high dose, with again, preferentially the higher dose of 6 per kilo per day having more improvement. The North Star Ambulatory Assessment was another functional score that was monitored as well, which also showed improvement that were clinically impactful as compared to placebo in both AGAMREE groups. And in terms of safety and tolerability, AGAMREE was well tolerated in these clinical studies. This is comparing both those groups to placebo, with the common side effects like typical for other glucocorticoids too, like the cushingoid features, vomiting, weight increase, etc. But here, looking at behavioral problems in particular, this was something that was particularly studied in this clinical trial. There was actually fewer behavioral problems when we compared to prednisone, not just placebo, over the 24 weeks. And looking at the height and the growth for these patients, we know that glucocorticoids really impact your growth and can stunt your growth. So AGAMREE at 6 milligrams per kilo per day improved the high percentile week 24 compared to prednisone. So in this graph, you see changes in high percentile. So for example, if you were in the 50th percentile on the AGAMREE 6 milligrams per kilo group, you went up by 3.86 percentile points, whereas in prednisone, you went down at 24 weeks. And then looking at bone biomarkers as a short-term measurement of what this does to your bones and your bone health, we see that there were no deleterious changes in bone biomarkers for AGAMREE compared to prednisone over the 24-week period. So they were looking at these measurements, particularly osteocalcin, P1 and P, which are measurements of osteoblast activity and bone formation. So you see increased bone formation with AGAMREE and these blood biomarkers. Obviously, we still need long-term studies and to follow these patients over the long term to see if this is going to translate to decreased fractures and better bone health than in the patients with prednisone. So in terms of dosing, the recommended dose by the FDA after this clinical trial ended up being the higher dose, the 6 milligrams per kilo per day, because it was more effective overall than the lower dose. And there's a maximum of 300 milligrams per day for patients that weigh more than 50 kilograms. Obviously, if your patients have side effects, you might titrate them down to 2 milligrams per kilo as needed based on that individual tolerability. And if patients are getting switched over from other glucocorticoids, such as prednisone or deflazacort, the recommended dose is still also 6 milligrams per kilo per day. And you don't have to have any treatment interruption or washout period. You just start, from one day to the next, you would start the patient on AGAMREE 6 milligrams per kilo per day. So in particular populations, like patients that have hepatic impairment, the maximum dose is going to be 2 milligrams per kilo per day or 100 milligrams. And then when patients are using strong CYP3A4 inhibitors, the maximum recommended dose is going to be 4 milligrams per kilo per day or 200 milligrams. And obviously, it's only approved for ages 2 and above, so we don't have data yet on patients less than 2. And for those healthcare providers and physicians that want to start their patients on AGAMREE, Catalyst Pathways is a good patient support program that can help you obtain the prior authorization with insurance and can provide the patients with the bridge dosing until the insurance approval is worked out. I take it back to Lisa.
Thank you so much, Dr. Monduy. That was a really thorough review. Appreciate it. So to kind of wrap our discussion up today, I wanted to focus on sort of this evolving treatment landscape in Duchenne. And Jay and Franklin, you mentioned that to join the clinical trial and become a part of the study for vamorolone was a difficult conversation or decision on your part. But what was sort of the tipping factor? I know your relationship with your clinic and the amazing care you were getting at Duke certainly played into it. But were there certain aspects of what they shared with you around vamorolone or Agamree that sort of led you to say, you and your wife to say, you know what, this is the best option for Franklin?
Yes. They shared that the hope was that it would decrease some of the side effects, if not eliminate some of the side effects that's known in glucocorticosteroids. So, and they identified some of the areas that we could benefit by having vamorolone as opposed to the other ones. So I guess the whole idea was a hope of it performing differently than what we know is to be true. So that kind of like turned the ship a little bit. So,
Sure.
but when turning, we still had to deal with the issue of he's the first. So there was no validation. There was no validation for us other than what was presented in animal models. So the weight of that information wasn't as heavy, I guess, if you will, to be honest.
Yeah.
But yeah, so hopefully that answers your question.
Dr. Monduy, what other types of patients might consider Agamree as a treatment option in your mind?
So I mean, definitely in the trial, you were dealing with people that had never been on steroids before, that they were steroid naive. So there's definitely an option there. But obviously, if they've been in any of the other drugs and have side effects, so any issues with, particularly with behavior, we know now that there's less behavioral side effects with Agamree than prednisone, for example. So that might be a patient to think about, or patients that have issues with, bone health and osteoporosis and are at risk for fractures. So those particular patients, we think that over the long term, this should have less issues with that. So that might be a particular patient to think about. But especially the patients that are having issues with their growth, and this really impacts them in a social way because not only now they're in a wheelchair, but they also look shorter than their peers and they look younger than their peers. And then that could have a lot of a lot of
Psychosocial.
impact, yeah,
Yeah.
and the patient already. So those are the types of patients that I would consider it. And then again, have that discussion with families.
Very well said. My final question is for Jay and Franklin. If you had sort of some lasting advice or just some comments that you would want to make in terms of what do you want doctors treating Duchenne and treating patients like Franklin, what do you want them to know about Agamree and managing Duchenne? Anything specific come to mind that you think stands out?
I think just what the doctor said, is another option.
Yeah.
It's another tool in the toolbox. You know what I mean? Ultimately, families are going to look at everything that's out there and lay it out to see, which is the best route. But with Agamree, now you have validation of what Agamree does compared to the other options. So just communicating all of those points to the families, you know what I mean? Now they're going to be able to communicate with other families that's on Agamree. And you can get that real mom to mom conversation about their kids on Agamree, which
share that. Yeah.
that has probably more power than anything because you're sharing factual information with other families with it. So I think the whole medical community have something, another tool in the toolbox that they can, present and use as validation for a Gamma.
Well, you and Franklin are certainly doing a great job of communicating just by participating today. And I'm sure you meet with families at events and things like that, and you and your wife probably speak to what your experience has been. So thank you for educating the community about what your experience has been, the good, the bad, and everything in between. I think it's definitely helpful to other families to know what you've been through and what you've experienced. So really, really appreciate that. I want to also thank Dr. Monduy. Thank you so much for sharing your insights and for reviewing the clinical data. I think that's very important for the community to see.
Wow, such great information shared today. Thank you to Catalyst Pharmaceuticals for the insightful presentation, to Dr. Monduy, to Jay and Franklin for sharing your story, and to all of the clinicians and medical professionals who attended this webinar today. So we hope you will join us for future industry update webinars and have a wonderful rest of your day. Thanks so much.
Yeah.
Thank you.
Thank you.